Hi, Rebecca. How are you
Hello.
doing?
I'm doing well. Thank you so much. Sorry about that. I thought I had requested to join, but I think I was in limbo land.
No, no,
So
it's praise. It's a pleasure and honor to have you here. I know you're a busy person yourself, and but definitely super excited that we can have this conversation. And so there, once again, it's all about uplifting LGBTQ plus organizations, and the position that you're in, you have done so much uplifting and lifting, for the community, which we really appreciate. And there are several, questions, that I wanted to ask, just about your experiences, what you've been doing and what you've seen over the years. And then we can also take the opportunity to, have you ask me questions as well. And that'll just kind of highlight the collaboration that we're doing for the community. So one thing I wanted to ask you, Rebecca, is can you tell us a little bit more about the San Francisco LGBT Center, the history, how it came to be, and what the center is prioritizing right now at this point in time.
sure, great. I'd love to. So the center's been here we just celebrated 21 years. So we're a relatively young organization, just kind of if you equate organizations to people, just entering our adulthood. But we really were started, I think, at the height of the AIDS epidemic and really out of a desire to have something really lasting and meaningful and a true home for the queer community, the very broad and extraordinarily diverse community. And that's really what we feel like we've grown into over the past 21 years. And we're here to both celebrate and uplift all things queer and queer art and culture and voices and music and perspective, and also to make sure that every member of our community has the resources that we have to be whole and healthy and full, sort of full human beings. And so we do have a lot of direct services, really working with folks who are experiencing a variety of ways that homophobia and transphobia and race and sex and gender and economics sort of intersect in their lives. And so we've got programs to help people. We work with a lot of young people who have come to San Francisco seeking a place of safety and sanctuary and finding it a hard place to live. We offer support for people finding jobs, starting and growing businesses, financial literacy and capacity building, health and wellness. So a lot of different resources that can really be blended and mixed to what any individual needs at any given time. And then just also, as I said, a lot of celebration of community.
That's wonderful. I mean,
Yeah,
so many bases and so many levels of care for the community. And I think in many ways we, should, feel fortunate that we live in the San Francisco area and that we do have the SF LGBT Center. But certainly there certainly are issues. I mean, and I think what I wanted to ask you is, you know, how would you describe the state of the community, the LGBTQ community in San Francisco right now? What issues are specific, do you feel, for the city?
that's a great question. And I think San Francisco is a unique environment for the queer community. I think the queer and trans community, I think in some ways, we have the best legal protections in the world here. We also have, in many ways, broad social acceptance for sort of the sort of for a lot of queer folks. I think also we find a lot of folks coming here seeking a place of safety and a place where they can be themselves and come from, very challenging backgrounds and experiences in other places. I think one of the things that's interesting is a lot of people think that in San Francisco we somehow magically conquered homophobia and transphobia and
Mhm.
racism. And that's just not true. We see the same types of economic and health and other disparities here for members of our community that we see across the country. From the ways that young folks in our schools experience homophobia and transphobia, and some of the educational outcomes and impacts that we're seeing for queer and trans young people and non-binary young people, to the experiences of adults. And so I think it's important to remember that even here in San Francisco, that there still continues to be both the experiences that we've carried forward from the rest of our lives, but also the experiences that we have right here in San Francisco, and that we continue to see challenges every single day. And that is, you know, less, less true for folks who are white and well educated and cis and have a job and have a safe place to live. But when we really start looking at how, for trans folk, for trans women of color, for folks who don't have a, traditional education or a harder time getting a job, we really see those challenges really compounded, and, enormous sort of challenges just to survive, honestly, but to survive and live in a place like San Francisco. So,
Yeah.
it's kind of a, I think people talk a lot about a tale of two cities. It's kind of that, even amplified a little bit more for the queer
I
community.
could I could totally imagine that. And then, specifically for the transgender, the gender diverse community, so what programs and services does the center have for supporting patients or folks who are moving forward with gender affirming care or trying to seek it?
It's a great question. In all of our work, we really try to center trans folk, non-binary folk, folks of color as sort of the center of, of the analysis. And we figure that if we're meeting the needs of trans folks, cis folks are going to get served too. It's just the nature of how that works. So everything we do, we try to really think about what are the specific needs of trans, gender expansive, gender non-binary folk, and then how do we really make sure that our services are really being built around what those needs might be. In some cases, we really look at the very specific needs of trans folks. So for instance, in our employment program, we know that there are some very specific barriers that transgender and gender expansive folks face in finding and sustaining employment. And so we really structured a program that within our overall employment program, about 60% of the work we do is with trans and non-binary job seekers, and really looking at addressing those specific barriers. Also in our youth program, we see a lot of folks coming in who are identify, across the very broad and expansive gender spectrum, and, really wanting to make sure that those services are available. We have some services that are very specific. We have a new program that a group of great folks started here at the center called Fresh Starts. That's particularly for trans femme folk,
Mm.
and really looking at it's intergenerational. It includes folks who are really just exploring that, where do they sit in that spectrum, to folks who have, feel like they're sort of elders in the community, and really can share advice across both age, intergenerationality, but also just folks very, in very different places on sort of really exploring what that looks for them. And we're starting a new group for transmasculine folk. And so, some specific places and some specific services, but also making sure that all of our services are really, again, centering that. And we know that, people are, there's a different set of what feels right for every person. And so we just really work with everyone to look at, for each person, what is it that they need in order to feel whole? And, if that's, whatever that might be, we're here to support them in that journey. And, that is for some folks, medical, surgery, other types of medical solutions. For other folks that's not, and we'll work with them to support whatever that is. But we're super fortunate to be in a place where we have services like Align, and physicians like you who really are here to support the community. And I think to create, a really positive and, well, to use the term of our time here today, uplifting sort of opportunity for people who feel like that's the solution that's going to work for them. So I have a couple of questions for you too, if that's okay.
Oh, let's. I'm. Yeah, since we're it's a two-way thing here,
Yeah,
so I don't want
yeah.
to. How, how
Well,
can
my first question is just to be a little bit personal. I'm wondering how did you get into this work? And then, I'm thinking that for you, for someone who gets to be really a part of someone's very important journey to, to really finding the solutions that feel right for them, like what is it like to get to be a part of someone's journey and to get to be such a, in some ways, sort of integral piece of some really important steps that people are taking towards what feels like, their happiness and their whole self.
Sure. And I think, we're both doing the same things. We're helping people on their journeys, right? And we're trying to find what it is that they need, as you were saying, to allow them to continue on with that journey, with that difficult journey. So for me, just from a personal standpoint, as far back as I can remember, I know I've always wanted to be a doctor, always wanted to be a surgeon. And I always knew that I wanted to work with people who needed the most help. I've always wanted to work with marginalized, disenfranchised people. It was just very, very important to me. For the longest time, I actually thought I was going to be a pediatric transplant surgeon. And then I did my training at Stanford, and then I met plastic surgeons there who were doing wonderful reconstructive work. Prior to that, the only views or thoughts that I had of plastic surgeons were what you saw on TV, cosmetic surgery in Beverly Hills. And there's nothing wrong with that, of course, but that was just what I saw. And I was like, oh, that doesn't really fit me. And then when I saw these amazing reconstructive procedures that they were doing, I was so just in love. And I saw this talk. It was that Dr. Doug Ousterhout had given years ago about facial gender affirming surgery, and I absolutely just fell in love. He had this passion for the work that he was doing. He loved his patients. It just matched everything that I wanted to do. And I think for me personally, being gay, being Black, being Filipino, I think there have been a lot of struggles that I've had in my life that allow me to sympathize with certainly with the community. I can't. Once again, I do have my own set of privileges as a cisgender man, and so I, granted, I cannot 100% empathize with the struggles that so many of members of our community have gone through, but I can certainly sympathize, and I can certainly understand and feel and know, many of those struggles. And so that definitely allows me to connect and move forward hand in hand with their patients. So once again, the wonderful talk that I saw from Dr. Ousterhout, I met all these other wonderful people at Stanford. Dr. Don Lobb, who was a pioneer in gender affirming surgery, who died recently, which was quite sad. One of his collaborators, Judy Van Masdam, took me under her wing. She had been heavily involved in WPATH and guided me along. And then this was, in 2010, 2011, when I really had my interest, and it was ultimately 2014 when I started performing gender affirming surgery. It wasn't that long ago, but even then there weren't any training programs. I couldn't find anyone to work with, and I was fortunate enough to meet another surgeon and joined him and spent time with him for about 4 years, and then eventually went out into my own practice in 2018. But the work that I do feels like home. This is my comfort zone, and so I can't imagine doing anything else. And it's interesting because I have patients, occasionally who'll come in, who'll ask for non-gender affirming procedures, and I'm like, oh, I feel strange talking to you because I'm just not used to this, right? But it's just, this is what feels so natural, and what feels just right for me. But it is a journey. It's all about, as you said, Rebecca, is about listening. What is it that each person, each patient needs? Because everyone's different. Everyone is unique, and I want to do whatever I can to celebrate that uniqueness, not to force my particular ideals on a patient, but to be like, hey, I'm here to help you. What is it that you need? I will find a way to help you in this process, and it's just extremely rewarding, as you know, for that. And then to have patients to be able to have a positive experience in their journey, and they can reach out to other folks and guide people along as well. That's what I like. It's just such a collaborative effort that when you help people, they help other people, and then we all just are, united in that mission, which I think is so magical.
Mm-hmm. That's great. I think, one of the things that I was thinking about as well is because that's really 100% of what you do. I know one of the things that we've experienced here is that many of the folks that we work with in the community have never received services elsewhere except from the center, in spite of the fact that they're fully eligible for services from a lot of different service providers. But there's something about coming to an LGBTQ specific place. And I think that, I'm thinking that's probably true for you as well, that there's something about, people being able to go to a place where they know that that's what you do and that's really what your expertise is. And also the assurance that they're going to be treated with respect and care and appreciation and sensitivity, I think it's really a different thing because, I think so many folks in our community have not experienced that in medical settings and other places. So to have a place that really is, that's your mission and that's your work is, I think, really very special and very unique.
Yeah, and you're right, Rebecca. I think and once again, for the both of us, it's about creating a safe place for our community.
Mhm.
I've seen this many times where patients, will be they've had just a history of having doors slammed in their face, just being mistreated by doctors at a variety of healthcare facilities. And so I want patients to just come in and people to come in and feel immediately comfortable and safe and welcome, where they can feel okay to be vulnerable, to let their guard down, to be honest, to know that, things that they're going to tell me are not going to be used against them in any
Mhm.
way, right? That they don't have to put up a front, that they don't have to, make up a script in order to move forward. And so that's what I value so much. So just with myself and with the other surgeons and the rest of my staff, is about creating this environment of safety so that patients can be honest with us and let us know about any medical issues or social issues, transportation issues, anything that they're homeless, right? Just tell us because we're not going to use that against you. We understand, and then we're going to just do whatever we can and work with the community, work with you, Rebecca, work with other folks throughout San area to find the resources to help our patients be able to move forward, safely within operation.
Great, great. That's wonderful. I have one other question, which is I know that, sometimes medical care and intervention can be really expensive. And I know that you have a lot of resources to really ensure accessibility for gender affirming surgeries for individuals from lots of different backgrounds. I'm wondering if there's anything you can share with us about that as well, because I know that's a question a lot of people have when they come to us is how am I going to this? I know what I want, I don't know how to pay for it, or how to
Yeah,
get.
it is. And the financial landscape is quite confusing. It's even confusing for me, and I'm in the midst of it. And so I'm fortunate enough to have in our practice, just a team and employees who are dedicated 100% to working with patients to make sure that the process is going to be very easy. Because there's certainly, other practices or centers where a lot of that burden is put on to patients, but we really want to make sure that it's easy for patients when they're working with us. I would say, over 98% of our patients are under insurance. Half of our patients are under some type of public insurance or Medi-Cal or a variation of that. A lot of patients who are under San Francisco Health Plan. And so, we really want to make sure that anyone from any socioeconomic status is going to be able to move forward without a huge financial burden. I would say that at least 60%, if not more, of our patients are patients of color. We have a very high percentage of our patients who are African American or Latinx as well. And I think that also is going to be, it's just, as we know, it is an underrepresented and underserved segment of the community that we definitely want to be able to help. And so what we do is, so for any patients who reach out to our office, they let us know what, insurance plan they have. And then we tell them, these are the steps that you need to take. We are in network with a couple insurance plans. Other ones, we do what are called letters of agreement, where we talk, where our team talks with the insurance company to come up with like a one-time agreement with that particular patient. We want to be as transparent as possible. If for whatever reason an insurance company doesn't provide coverage, and insurance companies will throw all sorts of random stuff at you, but we will fight, we will push back, we will appeal. I talk with the medical directors of those particular insurance companies. We have, several people who are also, lawyers or attorneys who work with us, several of them, for free to help in that process. So we really have a system to be able to move forward with making sure that patients can get appropriate coverage. Because it is, as I said, it's so confusing and it's so hard. And I think there are patients out there who do have, who can move forward with gender affirming surgery, but just aren't aware that they can, or could be they're intimidated. They're like, oh my gosh, I don't know what to do, or it just seems so hard. And so from the moment folks call us, we're like, okay, this is what you need to do. This is how we'll get you along in the process. So I guess the question that I have for you, Rebecca, so what is it that we can do at Align, to help in that process, to help patients know that, surgery is an option for them? Because I want to make sure that, people are definitely aware of the care that they can get.
Yeah. That's a great question. I think things like this are great, and just an opportunity for people to hear about like what might be available, and even if, whether they know exactly what they want but don't know how to get it, or maybe don't even know what they want, or even what the options are, because I think, there's more and more, things look really different now than it looked even just, not too long ago. And so I think there's a lot more, options and resources available for people on a sort of constantly evolving basis. I know it's really helpful for, our staff and the staff of the other organizations that do work with folks in the community, just to always have great resources to refer people to. It's really helpful, I think, to know that people can just reach out and begin a conversation with you all without even, sort of, I think sometimes people feel like a call to a medical provider is the last call to make, but it's probably not. It's, maybe good to do that early in the process and get a sense of that. We're always happy to look at hosting things here, and having more information available to some of the groups that we do, or, some of the programming that we have, just so folks know their options. We also have started, in the last year and a half, really, we started a program where we're really connecting with LGBT centers around the country,
Mhm.
and particularly in places where folks are experiencing, more of the, you know, really the hateful things that are happening to the broad LGBT community, but particularly the trans community, and really looking at how we can make sure that people feel supported and connected, and also look at, for those of us who are lucky to live in places with higher levels of acceptance and sort of more legal support and more resources like Align Surgical, what can we do to partner and help support folks in those organizations. So love to, sort of continue this conversation about how maybe we could, in sharing resources, also help folks in other places know more about the resources like yours that might be available, either locally, or I know a lot of people really come here to San Francisco seeking, that this is the place where they can get the care that they need, and that San Francisco continues to be kind of a yellow brick road for many. I think those are all great
I
things.
do
Um,
agree. And I think that, gender affirming care and surgery, what I oftentimes tell patients is that the operation in and of itself is the easy part, is everything that you have to do before and everything after that takes a lot of time and resources. And so during my consultations, I make patients aware of that. And that's why it's important for, folks to be as open and honest with me, because then if I know, once again, I like the analogy, what you said, the holes, what's missing. Once I know what those are, then we can find ways of filling those in. So if transportation is needed, there are a variety of transportation services, home health nursing care that can be provided as well, housing as well that can be provided, even free housing that's available throughout San Francisco and the Bay Area if needed. So there are lots of different things. And I think if patients know that, they're like, okay, this operation is possible, for me, right? I think that is going to be key. And I think that when patients do make points of contact with, their primary care doctor, with you and your team at the San Francisco LGBT Center, right? I think it's important, and even for me, like I want to be able to direct patients appropriately, and I think that with this collaboration that you and I are having, and with the rest of the community, I think it's great. The more people that we know, the more people that we connect with, the more we can appropriately refer patients to the care that they need. Right? It is a collaborative effort. I think trying to create silos, and even among surgeons, there's have a stereotype for just being like selfish and egotistical. But I think what's great about the gender surgeons who do gender affirming care, I think everyone who does gender affirming care, we're a friendly bunch. We do talk amongst ourselves. We're dedicated to the community more than anything else. So I'm friends with all the surgeons who are here in the community. I know everyone, throughout the country and even worldwide. And our mission is to focus on our patients, not to be competitive. What's the point of that? So research, collaboration, discussions. I think those are all super, super, super important. I think with that, we're actually getting close to the end of the hour here. We have about 45 seconds left. This went on quite quickly. We could have talked forever, but I know that this is a starting point for you and me, Rebecca, to continue this discussion as well. I wanted to certainly thank all of the people who joined tonight and listened in. And once again, our goal is to uplift. Let's keep uplifting. It was a crazy year, so let's do
Yes.
uplifting. Ooh. But Rebecca, any final words from your end?
No, just thank you so much. And it's just such a pleasure to talk with you. Such a pleasure and really an honor to talk with you. So thank you so much for having me and for all the incredible work you do with the community.
It goes both ways. So take care, Rebecca. Good night, good morning, good afternoon. Take care.
All right.
Till next time.